and welcome to Helios Skin, Hair and Laser Clinic. Sports and skin, that is our topic. Dr. Madhumitha.
Dry skin, when it exceeds to an extent, it can lead to defective skin barrier, lead to other types of allergies.
Welcome to Helios Skin, Hair and Laser YouTube. Today we're going to be talking about yet another interesting topic, and this time it is sports and skin. We already heard Dr. Shraddha talk about how to take care of skin for the outdoor sports activities. Today I have with me Dr. Madhumitha, who's going to be talking to us about skin care for those who are specially related to water sports, and definitely something that all athletes need, because most athletes take care of their physical fitness, but seldom do they take care of their skin. So welcome Dr. Madhumitha, and thank you so much for joining us. So water sports is something that is again growing as a sport, not just in our country, but it is prevalent around the world. Like I said, not many athletes take care of their skin. So how important is it for somebody to take care of their skin, doctor, especially those in the water sports?
So when compared to others, the general public or any other thing, people in sports tend to get more sunburns, and especially people in water sports, the risk of sunburns and also the risk of dryness and also even infection is common. So they have to use specific type of products. Suppose if we say sunscreen, their sunscreen has to be a little bit different from the normal sunscreen, and they have to use a specific type of moisturizer where they have to check for certain contents.
Dry skin you mentioned, doctor, that is something that I wanted to ask. So people in the water sports, the athletes who are involved in water sports, it could be swimming or it could be surfing or anything related to water, tend to get dry skin much more than those who are in the sun. So how do they treat such dry skin related infection, doctor?
So that's mainly because of the dryness of the natural oil or the sebum which is there in the skin. And surfers or even swimmers, they have the tendency to take hot shower soon after swimming, and I think that they are notorious to take hot showers. They have to avoid that. So it's better to apply a moisturizer before going for swimming, and then after swimming they have to immediately take a short quick shower, and then they have to reapply the moisturizer soon after that. So by this way they can prevent excess dry skin. So some might say that it's just dry skin, I can just manage with something else. It's not that. So dry skin, when it exceeds to an extent, it can lead to defective skin barrier, which can even lead to other types of allergies, where an allergen can enter through the defected skin. Since the barrier is not there in proper condition, even infections can occur through that dry skin.
So you had just explained about how infections can occur through dry skin, doctor. What about the swimmers, especially those who use the swimming pool a lot? They are always facing chlorinated water. So what kind of infections do they meet, and how can they treat those infections?
Sometimes we see the transmission of viral warts. So if the water is not disinfected with proper chlorine or salt, then it can lead to transmission of viral warts. So it spreads from one person to another. If a person with warts has been swimming, then the chance of other people getting it is more. So the water has to be properly disinfected and changed frequently. And one more thing is, people tend to wear the damp clothes for a long time, even after coming out of the pool or even after the sea swimming. So this damp clothes will keep the skin in a damp condition. That's the humidity will be there. So that's one of the main aggravating factor for fungal infection. So it can either cause fungal infection or it can aggravate an existing fungal infection, especially over the folds. And then there are certain fungus in your body as normal commensals in a particular form. In this damp condition, it tends to change to a different form, and it can lead to some white spots all over the body, especially on the chest and the back, which we call it as pityriasis versicolor, and that's what in Tamil they call as temal. So that's one of the cause for that. And there's one more thing called chlorine allergic dermatitis. So chlorine, because of its known caustic action, it's known to cause allergic reactions also. So it's better to take a quick shower in a normal temperature water or lukewarm water as soon as you come out of the pool.
Doctor, since we're talking about swimming pool, there is something called a swimmer's itch. So could you elaborate on that and tell us more about the swimmer's itch?
The scientific term or the medical term for swimmer's itch is seborrheic dermatitis. It's nothing but, and one thing I want to tell is that it's not usually seen in the swimming pool, in freshwater lakes or even in seawater, something like that. It's basically the penetration of a particular larva into the human skin.
Okay.
So at the penetration site, after several hours, they might feel some pain or some itching or redness. This happens after several hours of penetration of the larva, and then after some time they can develop some itchy lesion over that, which will be like a pimple like lesion or a fluid filled small vesicles or something like that. So this will usually settle down spontaneously in a span of 1 to 2 weeks. If it is very symptomatic and if it is very disturbing, then they can contact a doctor. But at the same time, very rarely it can also lead to systemic symptoms. Systemic symptoms are nothing but your inner organs or immune system is reacting to it. So it can result in fever, cough, chills, that also.
So, doctor, there is a general saying among swimmers that if you can use oil before they get into the water, especially if they are doing sea swimming or lake swimming, it's good for the skin. Is that true, or is it a recommended practice for swimmers?
So application of oil before swimming will help in controlling the dryness of the skin, whereas it's not going to prevent the tanning or it's not going to prevent you from getting infected. So it just acts as a barrier where it will not allow the moisture from your skin to come out. That's just like a physical barrier. Apart from that, you can't prevent tanning or infections.
Doctor, since you mentioned tanning, people who get into the water get more tanned than somebody under the sun. So why does that happen, and how can one take care of that particular kind of tanning that happens because of water?
So when you're on the surface of water, you're getting the light which is directly falling on the skin. Apart from that, water surface reflects some light. So that reflected light is also falling on your skin. So you're getting both the light on your skin and the tanning is more. And some amount will get refracted, and which goes into the water layer, and that is absorbed by the water. So the absorption of the UV rays by the water is more as you go down. So if you're, suppose if you're 1 feet underwater, then the exposure of UV rays is like 85 to 90%. If you're 2 feet under the water, exposure of UV rays is like 60 to 65%. When you're 3 feet down the water surface, you're like just 40 to 45%. So as you go down, the exposure of UV rays is less.
Because the penetration of the rays are.
Rays. So basically this tanning is because of the UV radiation. Whereas there's something called immediate tanning and delayed tanning. Immediate tanning is because of the UVA rays, whereas the delayed tanning is because of the UVB rays. So you get tanned because it's like a combination of UVA and UVB rays.
Doctor, since we're talking about tanning, we all do know that there are sunscreens available. So do someone who's getting into the water use the same kind of SPF and the same kind of sunscreen that you would use when you're exposed to the sun? Or do they have a specific sunscreen that they can use?
So I would suggest to use a sunscreen with SPF 50, that is sun protection factor 50, which will give them protection from 98% of UV rays. But if you see, like a normal person who is not a swimmer or anything, sun protection factor of SPF 50 will give you 98% protection for a duration of 3 hours. So they have to reapply it every 3 hours when they are like outstation or outdoors or something like that. But when you're a swimmer and when you're in water, a sunscreen has to be reapplied every 40 to 80 minutes. So see the content of the sunscreen. It should be a combination of physical and chemical sunscreen. And one thing is, physical sunscreens provide immediate protection. And physical sunscreens reflect the sun rays, whereas the chemical sunscreens, they absorb the sunlight. So you just check for the composition. There should be zinc oxide or titanium dioxide definitely in that composition. And then some sunscreens are very specific for swimmers. It comes as water resistant or very water resistant. If the sunscreen is mentioned water resistant, then you have to reapply it every 40 minutes. If it is mentioned like very water resistant, then you have to reapply it every 80 minutes. So apart from the sunscreen effect, this silicone in the sunscreen is an additional thing which will provide a physical barrier. It will seal your skin. So it will be like a thing between your skin and the water.
Right. Since we're talking about tanning and water, and in relation to that, doctor, is swimming in the pool, less infectious than swimming in other water bodies like the sea or lake, or even smaller water bodies? So, is there something like there is a safety, or the risk factor is less and more?
So if we see the type of infection, as I said, if it's like fungal infection which mainly occurs on the folds, that is because of the dampness. So no matter if you're in salt water or in chlorinated water, or sea water or pool water, the risk of fungal infection is going to be there if you're not maintaining your skin properly, if you're not following the post swimming care, all those things. So if you take viral warts, the risk is more common in swimming pool rather in sea water, because it's just a small space and many people tend to swim in that, something like that. And if you see infections like this cercardial dermatitis, which I had told, the penetration of larva, it's very very rare, and it's not even seen usually in swimming pool, and it's seen in freshwater lakes or something like that. When apart from infections, if you want to see the chlorinated level and the allergic reactions caused by chlorine or something, seawater is preferred than if someone is having too much chlorine allergy, seawater is preferred than a pool. But nowadays the traditional chlorinated pools have been replaced by saltwater pools. Yeah, so chlorine is basically added for its disinfectant action. So nowadays a chlorine tablet or chlorine powder is not added directly. Instead, a salt is added and a generator is added along with that. So it will release something called hypochlorous acid, which is a disinfectant.
Doctor, surfing is become a very very common sport now, and it's catching up definitely in our city. And I've heard a lot of surfers complain about jellyfish sting, which happens when they are surfing. So how can they, treat if they're stung by a jellyfish? I'm sure that will be useful for all the surfers out there, from the expert.
So these jellyfish have some tentacles, a structure called tentacles. From that tentacles, a coil structure comes, and that is the one which is containing the venom. So when it comes in contact to the prey or to the human skin, this coil structure uncoils and winds, and it releases the venom very forcibly. That's why you're having that stinging sensation. So if it is like a very mild type of jellyfish, then it might lead to only cutaneous infection, that is a skin infection or skin allergy, which can be treated at the skin level. If the venom is injected in a larger amount, or if that is a dangerous type of jellyfish, it doesn't stop with the skin alone. It can even lead to shock, and even the venom enters the muscles also, right? So it can lead to muscle spasm, and it will lead to drowning. So it's always like, it's not that the jellyfish thing is just the skin level burn. You have to be always careful, and also see whether the patient is fine or not. I mean, the person is fine or not. So if a person is getting stung by jellyfish, immediately you have to bring the person out of the sea level, because we don't know whether it is a dangerous thing or not. To prevent drowning, we have to bring him soon from the sea. And it's said that keeping in hot water nearly at some 40 degrees Celsius for nearly half an hour will denaturate the venom. So the sting site, the affected site, has to be kept in hot water continuously for some half an hour, and then it has to be cleaned with soap water, and there will be pain or stinging sensation over the site. So for that, you can either use a vinegar or ice pack after keeping in hot water for half an hour. And then there are certain medications you can consider a doctor. Allergic medications, you can consider a doctor and take it. But in very high risk areas, some barrier creams, like how we use mosquito repellents or something, right? Some specific barrier creams like is available in high risk areas, which will give protection against jellyfish. But I'm not sure about the exact composition of those.
So, doctor, that is very, very useful and a very interesting piece of information that you gave about jellyfish stings. I have seen surfers use vinegar. They say even meat tenderizers can also be applied, and vinegar is definitely the number one meat tenderizer. Thank you so much for that information, doctor. We spoke about sunscreen. So, sunburn also happens with water sports and the athletes who are involved with water sports. So how does one treat those sunburns?
So they have to use a proper barrier cream type of moisturizer. They have to check for contents like high concentration glycerol or essential oils or petrolatum or even dimethicone, which I had mentioned earlier. It's a silicone based one, dimethicone. So use a moisturizer with these contents, and then apply a sunscreen, which should be a water resistant one or a very water resistant one. So make sure you reapply the sunscreen every 40 to 80 minutes. And then it's always important to wear a cloth which has sun protection, where it's mentioned as UPF 30 or UPF 50. It's better to use a clothing with that, and then make sure you cover it entirely.
Thank you so much, doctor, for such useful information that you have shared, and I'm sure all the water sports enthusiasts will take some tip from whatever you have shared. While you enjoy your sport, whether it is for competition, for pleasure or for passion, make sure that you take care of your skin, because it is the most important protective gear that you have. So while you are happily practicing or competing, don't forget to take care of your skin. Happy sporting!